Welcome back, guys. We're going to now go through the uncommon lawnmowers, the uncommon lunge matrix and pivots, as well as our uncommon shoulder to overhead press matrix. So uncommon lawnmowers, again, for us, meaning as a reference point, our ipsilateral, our same arm, same leg loading. I like to use a lot of these guys, these uncommon guys, to kind of go after the TZ2, kind of hip, foot, and ankle type stuff, but we'll dig into that as we go. And again, we'll kind of, to shorten things on up, we're not going to go through all 6 different kind of shoulder overhead presses. I'm just going to throw a couple on out there, a few out there for each one, and then let you guys spin it off and play with it. So we're going to go right foot as our base foot right now. Dumbbells in the left arm, or resistance, whatever it is in the left hand. We're going to take our little anterior lateral lunge. So a little anterior lateral lunge, and we're going to drive with a little in-sync rotation and reach. So in TZ1, we know foot and ankle, then the calcaneus is going to evert, which is going to allow the subtalar joint to evert as the talus drops down and in, which allows the rear foot to disassociate and separate from the midfoot, giving us dorsiflexion and eversion at the mid-tarsal joint and relative inversion of that midfoot and forefoot as the leg and as the pelvis and as the femur spin to the right over this TZ2 hip. So that's a good start. Give us that good internal rotation. So right here, from him, we'll go to a true kind of pivot lunge. So a posterior medial pivot lunge. As I pull with the left, I drive my in-sync rotation of the right upper extremity. So again, our reference points are pelvic girdle and shoulder girdle. I'm here, and then I add my transverse plane press. I add my common transverse plane press. Anterior lateral, kind of ipsilateral lunge, transverse plane press. With these guys then, as I load, I'm going to drive kind of frontal plane uncommon, drive frontal plane uncommon right here, which is going to help load this TZ1, kind of foot and ankle, dorsiflexion and a little inversion. We'll come here, and if I went frontal plane common, as I press away, I drive the right butt to the right, loading the right hip into further to adduction, which is what we need in TZ1, as well as dorsiflexion and eversion of the right foot and ankle. I can also go a little uncommon transverse plane to really go after loading that TZ1 butt. So with these guys as well, as we've talked about and discussed before, we can go straight posterior, we can go straight posterior, or we can go medial. So what that's going to look like, drive our in-sync rotation loading, we're going to lunge posteriorly with our pelvic lunge, take out the slack in the sagittal plane, add our common transverse plane press. So here, posterior, and let's add a little bit of our, of our little uncommon frontal plane right here. So as we do that, we're going to go after kind of that TZ1 foot and ankle, get a little dorsiflexion, a little inversion. And then one of my favorites, I like to drive the uncommon transverse plane shoulder to overhead press to help load up the right butt and hip into internal rotation. We're now going to go anterior medial. So we're going to go anterior medial. So with my crossover for the lawnmower, I have everything rotating in sync with my load. Everything is rotating in sync to help further kind of facilitate right here what happens in TZ1 of gait. So I'm here, and if I go into a true pivot lunge, I go posterior lateral. On my load back, pulling with the left arm, driving with the right to get that left kind of in sync rotation, I spin the pelvis faster to the left than the femur, loading up that left butt and hip. I can further accentuate and facilitate that by adding my common transverse plane press. My common transverse plane press right here. Boom and boom. I can add my uncommon frontal plane, get a little dorsiflexion and inversion of the TZ1, that right foot and ankle, or I can go common to further load TZ1 hip into adduction, and then the TZ2 into abduction with the internal rotation here, taking out the butt on the right side. So let's do that again. So we can come here and here. And again, one of my favorites is the uncommon transverse plane shoulder to overhead press, so that we can load up right butt and hip a little bit more. We're now going to go into our posterior kind of lunge series, and I really dig on these guys because of what we can do TZ2 hip. So left foot and left arm. Left foot is going to be the base. We're going to be driving a little in sync for our posterior, so our uncommon lunge matrix. Boom. We're going to go pivot lunge anterior. We're going to drive in sync rotation with the row and of the pull. If I want to kind of add some progressive oscillation here, I can. I'll drive transverse plane in sync, or common press. So let's go load in sync rotation, pivot lunge, transverse plane, common shoulder to overhead press. Really loads up that butt and that hip into that internal rotation, and really drives that TZ1 foot and ankle lower extremity the way that we need to. Again, we can go with these guys right here. We can go anterior lateral to drive it. Take out the sagittal plane and to kind of go after that frontal plane. Load a little bit more, and then to drive the transverse plane. So here to here, we can go common frontal plane press. Common frontal plane to load the right butt and hip into that frontal plane. Kind of adduction and decelerate the abduction in TZ2 with internal rotation. And then we can also, here to here, we can drive our transverse plane uncommon press to load up that right butt into internal rotation. And depending on how we're taking that step, if we're driving the knee straight forward, get some dorsiflexion and eversion. If we're driving it on the side, we'll get a little we'll definitely get dorsiflexion, but we're going to get some inversion as well. We're now going to jump on into posterior medial and posterior lateral to kind of cap things on off. So with our loading, in sync rotation, posterior medial. If we're going true pivot lunge, we're going to go anterior lateral, just the same thing that we just did. We can also, which we didn't add at the time before, so we can hit it right here, is go straight lateral. So I'll go straight lateral with my lunge from that posterior kind of medial. So driving in sync rotation, I'm going to load that good adduction of the right hip, AB of the left. So really going after frontal plane. I can add my in sync kind of rotation through my common transverse plane press right here. Or I can go just a common frontal plane to further drive the adduction of the TZ1, AB of the TZ2. And then I can go right here to here and drive kind of out of sync rotation with my uncommon shoulder to overhead press transverse plane, really load up that right butt and hip in the transverse plane as I've taken out the slack in the sagittal and of the frontal here. My deceleration of hip flexion, deceleration of adduction.